Hi, I'm Justin Shorn, co-founder of Chirp. Chirp helps remotely monitor the well-being of aging adults. Many caregivers like Michael are burnt out and sick with worry. And Michael's not alone. In the US, there's over 40 million family caregivers, and their number one fear is a fall at home, which accounts for over $50 billion in annual healthcare cost. So what's happening today? Many use medical alert devices, but they're inconvenient to use on a daily basis, and while video is passive, it's an unwelcome intrusion of privacy. Chirp overcomes these challenges by offering a wall-mounted sensor that's both privacy-preserving and no effort for the care recipient. So how do we do it? Multi-sensor data is first analyzed on the device, such as walking speed or calls for help, and finally real-time notifications are sent to the caregiver app. The caregiver app is easy to use and shows current room occupancy, historical trends, and last week's data. Chirp is making a difference for families today. We announced a public beta, we were quickly oversubscribed, and 90% of our beta users converted to customers. And in stark contrast to medical alert devices, caregivers use the app daily. So the business model is to bundle hardware and services together with an expected lifetime value of over $2,000 per customer. So we're just entering the manufacturing phase, and this year we're going to focus on partnering with medical alert resellers, many of which have over 100,000 active subscribers. And the opportunity is huge. By just partnering with the channel, we're seeing a pathway to $100 million or 170,000 subscribers in 5 years. So we have the right team to pull this off. We've built and launched many products in the past, and a lot of what we've learned we can apply here. And finally, our collaboration with the Jarrah Center for Research right here in Hamilton has been a game changer. So our meetings with the LiONS, we scored excellent, and a lot of the feedback we've already been implementing. Finally, if we were to win LiONS LAIR, that would allow us to launch the product at a key trade show this fall and to manufacture demo units that we can give away to resellers for evaluation. So for the first time ever in Canada, there's more people aged 65 and over than under age 15. So we urgently need new solutions. So help join us transforming health in the home for aging adults. Thank you.
Thank you, Justin. That was a really interesting presentation, and it sounds like the product really addresses a big need. I was just wondering if you could go through a little more details on how it works from a technology perspective.
Sure. So the device itself is wall-mounted, and there's a radar sensor behind. And using the radar, we're able to track people in the home. It's privacy-preserving, of course, and we can track body speed, how much time spent in bed, and all that data goes up into the cloud, and then you can see trends and understand, is someone following the usual routine? Are they in bed too long, too little, sleeping habits, and all that's done using the radar sensor. In terms of the help detection, that's done with a microphone. So much like Alexa may wake up with kind of, hey Alexa, or what have you, we have our own kind of acoustic event detection that just triggers an alarm on hearing the word help.
And would a typical user need multiple devices to cover the, say if they're living in a 1,500 square foot space, would they need multiple devices to cover that?
Yes, we typically like to have one device in the bedroom and one in the main living space. You can kind of separate when they're sleeping, when they're moving around. We have some users that have up to 4, and we have some, if it's just a single room, it could be as little as 1. But typically it's 2 to 3.
Justin, can you describe, are there limitations in terms of what the device can pick up?
Yeah, I mean, so depending on, so the device can't go through walls, and that's partially by design, so we know real-time occupancy, what room they're in, if they're too far away. If the room is too crowded, then it's tough to find the care recipient from maybe a bunch of visitors, but we do have the ability for visitor detection. So if there is a home care worker or a PSW coming in, the device does have the ability to say, yes, there was a visitor today, or no, it wasn't, because a lot of caregivers want to know that care was delivered.
What about for detecting something like a fall? I mean, if this is passive, how do you pick that up?
Yeah, so the fall is a work in progress, actually. So high velocity falls are something we can do. The challenge sometimes is, define a fall. Is it someone that's slowly slipping off a chair and now is stuck on the floor and can't get up? Does that count as a fall? So there's many different use cases, so we are working through that, but that's where the help detection comes in. If anyone's stuck, whether it's a fall or they're too frail to get up, they can just use their voice to get help instead of pressing a button.
Right. Or if they slowly lose consciousness,
Right.
And, you know, I mean, they could be sitting in their chair and then
True.
are having an emergency, but there's no sound created, there's nothing like
There's
that.
no sound created, no. Depending on the care recipient, it could be distracting, and if there's memory loss, it could actually be worse than distracting. So it is purely passive. So you can create, as a caregiver, rules if there's no movement. So if somebody's in a certain spot for too long, you can get a notification.
Okay.
You mentioned the channel partners that you were looking to use or help you with distribution. Would you be able to expand on that?
Yeah, sure. So for us, we have kind of this crawl, walk, and run standpoint. So number one would be the medical alert reseller. So those that are already selling the wearable buttons, you know, where you press. This is a 30-year-old technology, but there's a lot of resellers out there that have a big subscriber base, and they would just white label Chirp, and we would just be a new offering that they can sell. Down the road, we like the insurance, especially in the US with Medicare Advantage, where there's a lot going on with reimbursement and reducing healthcare costs, and we believe that we can play a role in that.
Can you tell us a little bit about why Chirp versus a wearable?
The problem with the wearable is device adherence, essentially. So you can't trust somebody who's going to wear it on a daily basis, or maybe they are wearing it and they forget what it's for. So by being totally passive, you don't rely on the care recipient having to be trained, do something, forget something. The one time they may forget to wear it, they run to the washroom, they may have a fall. So that's where having a passive wall-mounted device, you know, overcomes these challenges.
You talked in your presentation about kind of your expected revenue on a per user basis. Can you
Yeah.
break that down a little bit?
Yeah, so we modeled it on what people are spending already on medical alert devices. So I mean, there has been a little bit inflation here, but let's say it's $50 per month if you're going monthly or higher. The expected lifetime value in the industry is 3.3 years. So if we just apply the same to us, and I think we can do better, if we apply the same to us, it gets us to the 2K.
But in your model then, they don't pay anything to have that device installed in the home. It's strictly the monthly subscription.
Yeah, the partner would typically own the equipment. So our channel partner would own the equipment.
Gotcha. Okay.
Do you think potentially there's an application in long-term care homes more on the, you know, selling one per room as opposed to trying for the consumer market exclusively?
Yeah, I think there's right now, I think it's difficult maybe right now. There's not a lot of new technology being bought in long-term care. I think we would also have to expand, which is on our roadmap, some of the use cases that would help somebody in a facility or skilled nursing, and that could be kind of breathing rates and bed alarms if someone leaves their bed. But right now, the main focus is on somebody that's living alone. And the other reason for that is because the market is just much bigger. So the market is way bigger, and there are well-established channels, those selling medical alert devices, or even telcos are selling a lot of medical alert devices, then we would partner with them. But yes, going into long-term care is something that we want to have as phase 3 as the product matures.
So just will you sell this also directly? Direct to the consumer?
That's
or
not
are you
the
really,
plan. I mean, we may initially just to kind of prime the pump, so to say, and get off the ground, but the long-term vision is to have a channel sale.
through distribution?
It really de-risks, you know, market entry, and we can get a handle on the cost of acquisition. We're not, you know, fighting over Facebook and competing with TELUS. It's better to partner with them than try and compete directly.
So you've talked a lot about the U.S. market. Will you launch in the Canadian market?
Yeah, we'll launch in the Canadian market, definitely. And I think, you know, it's just that the channels are more mature in the U.S., so there's, relatively speaking, less competition. The market's less fragmented in Canada. That means in the U.S. there's more channel partners available to us. So we'll try both. All the big trade shows are in the U.S. as well.
What is the competitive landscape? I know this is, you know, there's a lot of people doing research in terms of ways to deal with the aging population. Are there companies doing similar things to this, or?
Yeah, I mean, there's definitely, depending on how broad we define competition. I mean, there's obviously, you know, people like Amazon and Alexa that see an opportunity, and I think it really depends on, you know, business strategy. How far can you bend an Alexa device, a smart speaker, where it works really well for an 83-year-old that's living alone that may not have a smartphone and a credit card and doesn't have an Amazon account. But, you know, there are definitely new entrants coming into the space, looking at how do we reduce cost of care, keep people at home. And it's not just medical device, it's also consumer hardware companies that are seeing the opportunity as well. But we're verticalizing completely. We're not just viewing this as another use case, take a product for home security and try and market it to senior care. That's not what we're doing here.
Right. And what's the end game at 100 million?
Well, keep going.
Yeah.
That's just the first 5 years.
Can you talk a little bit about the research behind it? I mean, I guess what I'm looking for is, I think you addressed effectively sort of where you're, where you need to do additional work, but how did you get to this place? Because I would think that places like nursing home and people who, who have an older relative that would be using this want to be confident that it will work when they need it to work.
Right. Well, okay, so the first question, was it around technology or how we got to this decision on the market?
The technology.
The technology. So we started testing a bunch of sensors back in 2019. So number one, people didn't like the cameras, they're too invasive. Wearables had the device adherence issues, and there's a lot of people like Apple already doing that. Samsung, it'd be hard to kind of get in there. What we're looking at is people that are mainly kind of living alone now at home, maybe not as mobile anymore, but they do, so they're kind of in this middle space where they're well enough to be at home, but not so well that nobody's worried. So we surveyed the market, and what came back was, let's use this new radar that's just coming out. A lot of that's coming in the automotive industry. So everything that's in your car bumper, we're now commercializing and just reapplying it for the elderly care use case, if you will. These sensors weren't available, 2 or 3 years ago. It was motion sensors, and they just didn't work. So it was just kind of a convergence of new technology and timing that all kind of came together.
Okay, I'll ask you one last question.
Sure.
Is there any issues getting like the chips that you need for?
Yeah, I mean, there's definitely supply chain issues. We've had to redesign before we've even shipped because there's component shortages. So we've had to update the design to replace some, power management, that sort of thing. So yeah, we're going through kind of a difficult time in terms of supply chain, but we do see light at the end of the tunnel now.
Okay. Justin, really appreciate the presentation. You did an excellent job. Thank you very much.
Thank you.